Dr. Ken Finn.
Hello.
Nice to have you here. I told you off air that my vision was to sit here, during the podcast when I finally managed to get in a room with someone who's a medical cannabis expert, and do it while we're enjoying, the benefits maybe of smoking some medical cannabis or recreational cannabis. This is not the case, so I'll hold off on that episode for a later date.
Looking forward to watch that one.
Yeah, me too. But we have more important things to discuss, maybe more urgent things, more mature things to discuss before I indulge in one of those episodes, because I do think it's super important. We spent some time, recording an online course very specifically about the topics that I'm sure we'll cover bits of today. Mm-hmm. One of the lines you said that I like, you just said it a few minutes ago again, is that you used the word nihilist a few minutes ago, that you're not a nihilist. And also when we were in the studio, you mentioned one of your lines was, I am not a prohibitionist, but... So what is the but? What is going on today in the world of medical cannabis as you see it here, at least here in the United States, or even more specifically, if you want to take it, we're sitting here in Colorado Springs, Colorado. Mm-hmm. So what is the state of medical cannabis today?
Well, the state is ever evolving. I mean, it changes daily. I mean, I read 2 to 3 articles on it every single day, so that the data continues to evolve. And, personally speaking, I'm a live and let live kind of person. I don't really care what people do with the privacy of their own home. The problems I have with cannabis in general, because medical and recreational cannabis, the only difference between the products is the tax structure. So it's more expensive to get the legal recreational marijuana. So a lot of people will lean to be a medical marijuana patient. Mm-hmm. So it's cheaper to get the same product they're going to get at the dispensary. And for me, out of curiosity, just based on my experience with my patients, I got my medical marijuana card here in Colorado. And full disclosure, I don't use. However,
it was a pretty easy process.
Oh, it was terribly easy. It was frighteningly easy because, as you know, I'm very active and I've had surgeries. I was very college athlete and remained active despite all my surgeries. And so I signed up for an evaluation by a physician, and there was really no questioning. It wasn't really a comprehensive physical exam or history. The questioning was, do you have pain? I said, yes. Where is it? In my knee is my answer. And she never asked me my level of pain, which on a day-to-day basis is 0 to 2 on a 10 scale. But within a minute, she approved me for severe pain. And didn't ask for medical records, didn't ask for my MRIs, didn't ask to even see the scars on my knees, even though it was a telehealth. She just said, pull up your pant leg. And show me.
It wasn't even in person.
It was telehealth. Yeah, it was kind of during COVID.
Yeah.
And so within a minute, I won it. And, I could have gone out to any medical dispensary and got whatever products I have. And I think one of my biggest concerns is product integrity. Because if marijuana was truly a medicine with all of the inconsistencies of the product, if any other medication had the same side effects or poisonings and chemicals that were in them, they'd be pulled right off the shelves. Because the data shows that chronic marijuana users have higher levels of cadmium and lead, which are heavy metals, in their blood and urine. So,
do we know what defines a chronic marijuana user?
Usually daily or near daily, frequent user. Very frequent past 30-day use is kind of what the medical community looks at. I mean, how often are you using the past 30 days? A joint year is considered 1 joint a day for X number of years is how they try to quantify it. So if you're, a chronic, a smoker, for example, they smoke a pack of cigarettes a day. Yeah. They have 1 pack year. A pack of cigarettes a day for 365 days is a pack year. So similar with joint, some people don't really utilize that definition. But my concern is, what are the people really getting at the dispensary? Yep. And again, I don't care if you use, but my concern is, well, whatever you're using, whatever's in the bottle may not be on the label.
Yeah. So we've in the last probably a couple of decades, right, as we're moving into this world of legalization when it comes to cannabis recreationally and also medically, it's very much the mainstream PR around medical cannabis is very positive. At least since I've been alive, it's always been a push to get it legalized medically, of course. Like medically is like it's a given that it must be medically legal in every place in the world. So that's a given, since I've been alive and what I've been exposed to. And more than that, a huge force behind the recreational legalization. For many different arguments, but one of them being is, to allow people that relief that, if it helps them with anxiety, if it helps them with pain, if it helps them with, you name it, people can list a bunch of different things. So when I was, speaking to you for the first time to hear about your perspective on things, it was alarming because I haven't been exposed to these things. Every time I'm exposed to medical cannabis, even from an educational standpoint for practitioners, or even from a legal standpoint, or from a bro standpoint, it's always positive. Even when the people speaking are not users themselves, it's always a positive force. So what for the people that just listening to this first few minutes of the episode and need a reason to stick along with us until the end, what are some things that what is some truth that's going on, some real side effects that people are suffering from that are not really spoken about?
Well, one question I would have is, what other medicine do we have that's medication and recreational? There really are none.
Yeah, there are none. I need to think about them that are legally classified as medical and recreational.
And the problem is, and again, this is where I'm not a nihilist or prohibitionist. I mean, from a basic science perspective, there are components of the plant that have medical value.
So maybe we should talk about those first, then what we do know today that does provide medical value from
for example, there is a synthetic THC called dronabinol, because they've known about the molecule for decades, and they were able to synthesize the molecule. And dronabinol went through the normal drug development process through the FDA, and we have a molecule that treats chemotherapy-associated nausea and vomiting or weight loss associated with HIV and AIDS. I'm fine with that.
And does that come in the form, people don't smoke that, it comes in the form of a tablet?
Pill.
A pill, yeah.
It's a pill. And what other, there's no other medication that the delivery system is combustion. That is simply just not a healthy choice. I mean, we already know that smoking is bad for you. So why would you support another substance that's being heated, vaporized, and inhaled through the lungs when we know that the what's contained in the marijuana smoke is actually worse than cigarette smoke? And actually, this marijuana smoke has been shown in the medical literature to be worse for the cardiovascular system. They have the same amount of tar, more carcinogens in it. So we know they can be potentially harmful. But so there's no other medicine the delivery is combustion. And so that's kind of where my biggest concern is. We haven't done a good job. Well, like, for example, some of my patients may say, well, I drink 6 beers a night because it kind of makes me relax. Or I smoke a couple cigarettes because it treats my anxiety. Well, those patients are reporting benefit, but we know that what they're using is harmful. There are negative health effects, and there's tremendous societal effects. And despite all those industries creating so much money for the industry, we know that the societal effects outstrip any type of revenue. So that's kind of one of my concerns. I might have multiple concerns regarding the industry. So the marijuana plant, raw cannabis, shouldn't get a free pass. Put it through the drug development process. Give me a product that's been shown to be effective for condition A, B, or C. I'm 100% fine with that, as long as they're not contaminated with pesticides or fungicides or other poisons and heavy metals, and I'm all right with that.
So if it hasn't gone through the medical regulation, FDA approved drugs, how is it offered as a prescribed medication?
Marijuana is not prescribed, and that's kind of the loophole I see in these programs, because the physicians can hide in clear sight under the law and not get penalized if they have like an adverse event. So I can recommend, Danny, you use marijuana. I can give you your recommendation, but I'm not prescribing. And back to my personal story, the Colorado law requires the recommending physician have a real relationship with the patient. It's called a bona fide doctor-patient relationship. I don't have one with my doctor. Number two, the physician is required by state law to maintain medical records. That's like having a doctor-patient relationship. And I can't get my records from my recommending physician because they don't exist. So that physician, like almost all of them, not all of them, but almost all of them, are in violation of state law. I brought it up to the state. They don't care. The Attorney General, CDPHE, the Public Health Department, the Attorney General, Marijuana Enforcement Division, they don't care. They know what's happening, but they're not enforcing it, even though in black and white it's right there. You have to have a doctor-patient relationship that's bona fide, and you have to maintain medical records, but nobody's doing it. And those are some of my bigger concerns. So medical marijuana patients share their product. I've had patients admit to me, well, it's my year to get my card, and it's her year, every other year get her card. So it's unfortunate because I think it's actually doing a disservice for patients that might benefit from the cannabis, but my concern is the raw cannabis is frequently contaminated and poorly regulated. So my worry is that people are getting stuff that may be potentially causing them harm.
Without them knowing.
Without their knowledge.
Because they're getting the benefits that they're expecting and used to.
Well, part of the problem is the people behind the counter are called bud tenders. And the bud tenders
Is that the official name that they have?
That's the official name. The official name is bud tender. And there's no medical training required. So you have them running basically marijuana pharmacies, and behind the counter, they're counseling patients on, well, don't use this product, use this product instead. And on what basis and what foundation? And that's another one of my concerns. The industry is really lacking in providing the education for the people that are actually counseling patients that are coming into the medical dispensaries.
Yeah.
And that's another one of my concerns. I have a whole laundry list of concerns.
Yeah, no, I'm sure. And it's alarming to me. That's one of the points, the product integrity and even the potency of which we spoke about as well of the products. It was alarming to me because when anywhere you are in the world, you're exposed to marijuana users. On the streets of a lot of countries, not every country.
Amsterdam's the gold standard.
Amsterdam, but even you walk in England, you walk in Israel, you walk in Europe, you see it and smell it everywhere. But I one of the things I was always afraid of is, okay, you don't want to buy it off someone on the street because you don't know what's in the product, right? So I always assumed once I moved to America, if I'm in a state where it's legal recreationally, like a Colorado, California, if I'm standing in line and presenting my ID and going into a dispensary, that I have walked in with full trust in the system. But you're saying that it's not very existent.
No, the system is failing the consumer, in my mind. Like, for example, in Colorado, they were found to be inflating THC potency because they can get more money from a higher potency product. And other studies show, like CBD, for example, only 7.5% of the products studied actually had accurate labeling. So the product and the label were within a fair margin of correctness. Mm-hmm. Some products had no CBD in it at all. And some products actually had THC in it. So how is the old lady that wants to take a CBD gummy, for example, for her knee pain, going to understand that that product might have THC in it, which could cause problems? And CBD actually has more drug interactions than THC. Yeah. So those are some of the wrinkles that I see in the whole industry, is this the improbable way for them to correctly regulate it. Again, no other medication is having these problems. I mean, yes, there's side effects and adverse events to every single medication that's in the PDR, the physician desk reference, which is the big book that you can get it online now, but you can refer to any medication. They have a package insert. I can look at warnings and precautions. I can see how it's dosed. I can see how everything. But the problem is that the raw cannabis plant has like over 400 molecules that have activity in the body. So how can you say that raw cannabis, for example, is medicine. It doesn't meet the definition of medication. And that's another one of my concerns. Are there medicinal properties to it? Yes. But again, put it through the muster, like every other medication under the sun has gone through, and I'm fine with it. Give me that part. Epidiolex, for example, is purified CBD that's approved for pediatric seizures. And I actually know the authors I know the researchers that got it through the FDA process. And I'm fine with Epidiolex. But even the Epidiolex, the warnings and precautions are liver damage, suicidal behavior and ideation, sedation. So people are maybe taking CBD and they might fall asleep behind the wheel. And there's no good testing for CBD either. So if you get in a car crash and it's a CBD, they may not find that on drug testing. They really look for the THC metabolites.
When was cannabis legalized recreationally in Colorado?
We had medical marijuana in 2001 when we implemented, and we voted for legal weed in 2012 and implemented in 2014.
So since 14 then, what are some things that we see happening on the rise in Colorado, specifically speaking?
Our drug deaths are gone on the rise. Our opioid overdoses are higher. Our marijuana-related driving fatalities are higher. We have more kids in addiction treatment since legalization. So again, and we've had a significant amount of healthcare utilization. People are having a side effect or poisoning, and they end up in the emergency department with cannabinoid hyperemesis, for example, or maybe panic attack, or heart is racing. Those sorts of things that precipitate their need for the healthcare system. So like any other addiction for profit industry, like alcohol, like tobacco, like opioids, marijuana is following the same playbook.
So why don't we hear about those things? Why don't we hear? Because again, I'm not exposed to your world of publications and research in this topic, but just from the general vibe when it comes to cannabis recreationally even and medically. It seems like it's still very positive. People just want you to shut up and let people live and let people do their thing.
Right.
But what I learned from you, there's some scary things like poisoning and like psychosis, which are pretty extreme.
Yeah, I think the answer to your question is money and mainstream media. The mainstream media doesn't want to hear the public health and safety implications of expanded marijuana programs and commercialization. I mean, a lot of people, we never really had lung cancer was a problem until mass commercialization of tobacco. I'm sure people back in the 1600s got lung cancer, but we really didn't become a problem until mass commercialization and marketing and use. The perception of harm was low. Doctors prefer Camels and dentists prefer Viceroys. They had commercials on TV. I'm old enough to remember those. They had vending machines. And then when the whole cancer thing became a problem and you have emphysema and COPD and you have addiction issues with nicotine, it's hard to quit because nicotine is very addictive. Yeah. When that pendulum swung, then the perception of harm went up and the use went down. But now, interestingly, I don't know if I told you this, the tobacco companies are panicking. So they are investing heavily in the marijuana industry, heavily, because they have to pivot.
For people that, might only be smoking CBD joints, let's say, for their arthritis, whatever they're telling themselves, what is, so assuming they can trust the labeling of the products, is it a CBD versus THC thing, or is it ubiquitous to however really you're consuming it? Is it specific to how you're consuming, whether it's edibles or vaping or smoking, or is it just ingesting those 400 plus molecules into your body?
That's a very complicated question. Like, for example, the CBD vapes, there were some examples of, in Texas, for example, there was a gentleman that bought a CBD vape that wasn't CBD, even though he bought it in a regulated market, and ended up with a lung transplant because he didn't realize that whatever was in it caused a lung problem. The other thing is when you vaporize CBD, the number one product after heating it is THC. So people say, well, I don't want to get high. I'm going to use a CBD vape, but they don't realize that the basic science shows that you heat CBD molecule and it'll decompose into THC, which is maybe what they don't want. Because they said, oh, I used THC in college and I had an adverse event with my heart was racing, I was panicky, my head was rushing, those sorts of things. And the bud tender will say, oh, it's CBD, you're fine. Not knowing that the CBD is going to convert to multiple products, but the number one product from heating CBD in the vapes is THC, and maybe exactly what they didn't want.
So it's not as clear cut as even if the product labeling is correct, or even if the bud tender, whatever they advise you, what they're saying is correct. It's not as clear cut because our body processes things differently, and the process of going through combustion heat changes things when it comes to how we consume it. Even when it comes to like in my body, if I smoking versus eating it, is my body consuming the cannabis in different ways?
Well, for example, if inhalation is probably the fastest way to get the effect.
Yeah.
Because it goes right from the lung to the brain. It crosses into the bloodstream and then right to the brain. So the onset of effect is pretty quick, within 30 to 60 seconds, and can peak in 30 minutes and then taper in the bloodstream and then taper it down after a while. The oral route of administration, either with tinctures or with edibles, and that's where people run into trouble, is they eat a cookie or whatever, and they sit there and they go, I don't feel anything. And then they'll eat another cookie, and they're like, well, I don't feel anything. And then they eat another one, and it's like, bam, it hits them hard. And then they can run into trouble. Like, for example, Levi Tamba, who was a exchange student from Africa. He was in Wyoming around 2014, right when we legalized. And he came to Colorado with his friends, and he actually got a medical product. It's like, well, he's not a resident of Colorado, but he got his hands on a medical product. And the problem I have is all these, they're very attractive to kids, number one, which is a whole other discussion. But a cookie, for example, and it's a nice, like, it's a normal chocolate chip cookie you're going to get at the store, and the dose is like 1/6 of that cookie. I can't eat 1/6 of a cookie. I'll eat the whole damn thing, right?
Yeah. Or a packet of candy where the dosage is one tiny piece of candy. Yeah.
And so Levi took 1/6 of a cookie. He's like, same thing. Didn't feel anything. Took another. And the next thing you know, he became acutely psychotic and jumped out a window to his death. And so that's the danger of these products, is their potential. I mean, not everybody's going to become psychotic and jump out a window. I mean, don't get me wrong. Not everybody that drinks a beer is going to get in a car crash. Not everybody that smokes a cigarette is going to get lung cancer or emphysema. But the risks are there, and that's what people don't talk about. And that's why I do talk about it, because the public doesn't know. Physicians don't even know. When I do a lot of speaking around the country to groups like Mayo Clinic, UCLA, Stanford, and I always get a deer in the headlights. It's like, I didn't know that. And so that's why I do what I do, is because I feel like Horton Hears a Who. I'm like top of the mountaintop screaming. And for years, I felt like an army of one. I mean, I'm like, what am I not seeing? Why is my position this? And all of my colleagues don't care. What's the big deal? It's just weed. And for years, I'm like, I don't know what I was missing. So that's why I started researching and reading and educating myself. And over time, I started to find more like-minded individuals and colleagues around the country and around the world that are saying, look, time out. There are some public health and safety concerns that we have to bring to people's attention. And I can't tell you how many moms and dads I know that have lost children to suicide, homelessness, overdose, it's addiction, and it all stemmed from their marijuana use. And so that's the reason I do what I do.
Is marijuana we're using marijuana and cannabis interchangeably in this podcast. Is it, is marijuana the gateway drug that, again, every mother used to warn, their child, don't smoke marijuana because it will lead to worse things. Do we see it, playing that part?
People hate the word gateway. It's a trigger for the advocates. At the end of the day,
because everyone has heard that from their grandma, their aunt, or mom.
Right.
Yeah.
If you ask any heroin addict, did you start with heroin? All of them are going to say, no, I started with booze and pot. Progression. If you want to call it progression to other substances, fine. You can use that gateway, but nobody likes that term. The advocates hate the term. It kind of triggers them, and they get very visceral, and they get very angry. And a lot of times those people can't agree to disagree or have a debate or discussion and say, I respect your opinion. If you want to be a user, I have a lot of friends that use. I know people that use. But, my position is use if you want. But I have to tell you, these are the risks if you use. Just like if you were saying, hey, I want to drink a pint of vodka every day. Well, Danny, that might be not a good idea for addiction, liver, brain, that sort of stuff. And that's the thing with these other substances. Like tobacco, alcohol, and opioids are very simple compared to marijuana. That's what I find marijuana to be very fascinating, because it's much broader and deeper than the other substances. I mean, with tobacco, for example, you have addiction, lung, emphysema, that sort of stuff. Alcohol, you've got alcohol poisoning, so you can die. It affects the liver. You have liver damage. It has addiction problems and can affect the brain, right? That's pretty simple. Opioids, pretty easy. Take too much, you die. You stop breathing. Cannabis, it's like hyperemesis, poisoning, psychosis, stroke, heart attack, arrhythmia, addiction. So the number one target organ for marijuana is the brain when you're talking about psychoses and depression and suicide. Like, for example, marijuana is the most prevalent substance found in completed teen suicide now. Never used to be that way. 43% of kids that kill themselves in Colorado are positive for marijuana. Number two is alcohol at 27%. It's not like 43, 42%. 43% and 27% are out positive for alcohol. And, and the question is, well, why? They're not overdosing on it. They don't stop breathing, because that's not where the receptors, they don't live in the brain stem where, like, opioids will kill you, because that's where the opioid receptors are in the brain stem, where the breathing center is. So are they using because they're depressed, or are they depressed because they're using? It's probably a bidirectional relationship. It could be a chicken and egg argument. But the fact of the matter is that percentage continues to rise every year. And actually in Colorado, the percentage of anybody under the age of 25 that kills themselves, nearly over 30% are positive for marijuana. And that never used to be the case. So that's why it's important for people to really understand the risks on use, the product integrity, what's in it that I'm using, and because those are the things that concern me. Some of them.
For kids, adolescents, teenagers who are smoking, high school kids who are smoking on a chronic basis, are they also creating, long-lasting development issues brain-wise that they, that they wouldn't predict as kids?
Yes,
doing the cool thing.
Again, the brain is a target organ, and the brain is consistently developing as we age. I mean, they say that the brain doesn't fully mature till 25. Some are even saying 30 years of age. And if you're introducing a substance that can impact your brain as your brain's developing, there could be problems. Like, for example, there was a nice study out of New Zealand following over 1,000 people from age of 12 to middle 40s with a 94% retention rate, which is a very hard study to get that retention. And they found those frequent users, the near daily users, had lost their IQ by 5.5 points. And the area of the brain that modulates memory, the hippocampus in the brain, was smaller compared to their non-using or less frequent using counterparts. So it does make you dumb over time. Yeah. And I've known a lot of people that used during high school. I mean, I used when I was in high school, but different product back then. I mean, that was ditchweed, it was like 2 to 4%.
Which is also, so I think it's worth mentioning.
Yeah, 2 to 4% THC. That doesn't really exist. I mean, the average flower in Colorado is 20%, which is 5 times more strong than when I was growing up. And then you get the concentrates that are 60%, and you get the waxes, the shatters, the dabs that are, some claiming 90%, 100% THC. And that doesn't even look like a plant. Mm-hmm. So when they talk about, it was used in the Chinese pharmacopoeia, and it was God's plant, and in Peruvian mummies and all this other stuff, that product isn't around anymore, man. That's the stuff that's around now is not that. It's, I didn't know that.
Which is key.
Yeah, I didn't know God used a blowtorch to heat up his his dab and his shatter. It didn't happen. So I think it's important that the products aren't the same. Yeah. And again, I don't care about the stuff from the 1970s. It wasn't. It's like tobacco analogy. We didn't have the problems with tobacco until mass commercialization. Perception of harm was low, use was high. And then we're like, oh, we're seeing a lot of problems. Marijuana industry is still in its infancy compared to alcohol and tobacco that have a long track record, right? And opioids are kind of in between. I mean, that crisis started about 30 years ago and really hit mainstream in the early 2000s. And now people are backpedaling. So prescriptions are going down. Doctors are less likely to recommend because the perception of harm is very high, right? And its perception of harm for chronic alcohol is high. Cigarettes are high, nicotine. The perception of harm is very low in the world of cannabis. Like you said, It's like everybody's like, it's why are we not hearing what I'm saying? Yeah. And I think part of it is money and mainstream media.
So do you still feel alone, like the guy on the mountain shouting and no one listening?
No, like I said, I've been able to connect with like-minded people around the world that are publishing paper. Like there was one of our colleagues in Denmark published a paper earlier this year. It was a 50-year study of 6 million Danes, and the authors concluded that they could have the number of schizophrenia patients would have been about 30% less if those people didn't use cannabis on a regular basis. So the schizophrenia is on the spectrum of psychosis. And psychosis is a very complex medical diagnosis. I mean, it's multifactorial. There's environmental factors, there's genetic predisposition factors, but the piece that they don't talk about is the frequent marijuana use. If you go to any major city and you see the people talking to themselves, probably use drugs, there probably, more likely than not, was a history of cannabis use in there somewhere, either past use or ongoing chronic use. So the link to schizophrenia is becoming much more clear. People get into debates, is there a causal relationship or is it a strong association or correlation? Right now, I would feel that there's a strong correlation to frequent cannabis use and schizophrenia, which is on the psychosis spectrum. Yeah. And the more the recent data with adolescents, they have a 11-time higher incidence and risk of psychosis for an adolescent using, especially in today's products that are much more high potency. And in Europe, the data shows that there's a 5-fold increase in the adult for first episode psychosis, but the products in Europe are 10%. That's considered high potency when you get the skunk in Europe, or like in London, for example. Some say, yeah, there might be some higher products, but man, they are certainly not anywhere near what we have here in the U.S.
So, I'm assuming you're a busy guy, like, fighting to regulate or to, question what the hell's been going on with cannabis is not, your full-time job. So why? What got you into this?
What got me into this is I'm a pain physician, and I've been practicing for 30 years in this community. And when they first legalized for medical marijuana in 2001, when they implemented it kind of lied dormant for a while because there were no dispensaries. Physicians were afraid to recommend for fear of, litigation, losing their license. And then in 2009, after a lot of politicking, the dispensaries grew all over this town like daisies. And even today, the number of marijuana stores outnumber Starbucks and McDonald's combined. That says something. I mean, it's
in Colorado.
In Colorado, yeah. And actually in Seattle too. No, Seattle has more coffee shops. I think it was Portland or other large cities. The number of marijuana shops are higher than McDonald's and Starbucks combined. And so
which are freaking everywhere.
They're everywhere. So it's actually easier to get weed than it is a Big Mac or a latte in Colorado. So what does that message say, sending to people?
Yeah, it's scary. So is that okay? So that opened your eyes.
Well, as a pain doctor, I was seeing patients started to come in to me. We're in the middle of an opioid crisis. I mean, nobody's going to argue that. We have fentanyl overdoses. We've had record-breaking numbers of people dying every year.
Which we do hear about, yeah.
Yeah, 100,000 people every year dying from opioid overdoses. I published a paper that fentanyl death rates are higher in marijuana states than non-legalizing states. But I was curious because a lot of these patients are coming in on very high-dose opioids, so we have to try to work on tapering them. They say their pain's 9 out of 10, and they're smoking weed. I'm like, well, wait a minute. You got very high levels of pain and using opioids for pain and using marijuana for pain. I go, nothing. This doesn't make sense clinically. So I actually have a lot of very open conversations with my patients these days because it's not as stigmatized, which is good. I think that's a positive that came out of this whole thing with the marijuana industry. And when I pin them down, I say, look, you got high pain, taking opioids, you're smoking weed. What do you want? They say that that marijuana is a great opioid substitute or an analgesic, and I think the science is there that there's some analgesic properties to marijuana. And I say, let's taper your opioids, and you can go to the dispensaries all you want. And I tell you, 95% or more say, nope, I don't want that. It really doesn't help my pain. So that's what really flipped my switch and said, okay, well, I got to dig into this a little bit. Why are my patients telling me this when what we hear is that it's going to help our drug crisis, right? And as you know, every single year, there's more states legalizing for medical and recreational purposes. And in the medical marijuana, the number one reason people seek it out is for pain. But why do our drug deaths get worse and worse every single year? So to me, it doesn't make any sense. Well, it does make sense to me because you're promoting a substance that may lead to progression to opioids or they're using in combination. And again, fentanyl is a scourge. I mean, personally, I thought it spun out into its own little beast until we did the research and showed, well, wait a minute, fentanyl death rates are higher in those states that legalize for medical and recreational purposes compared to non-legalizing states. So there's from a basic science perspective, there's a very tight link between the opioid and the cannabinoid receptors and the endocannabinoid system. And it's to me, it's very fascinating. It's why is it not linked to the nicotine or the alcohol people? It's really from a basic science molecular. I mean, the receptors, they're like stablemate. They co-localize on the neurons that modulate pain pathways. I mean, the number one risk factor for an adolescent to misuse their opioids is having ever used marijuana in their lifetime. The predominant predictor for an adult to misuse opioids is having used marijuana before the age of 18. So there's all these little data points that I'm just trying to connect and just explain to my colleagues in my community, look, there's something here. There's no holy grail paper that says, marijuana and opioids, they're directly correlated or it's causing our opioid crisis. We're just seeing all these little correlations and correlations and correlations, and they're just building and building and building. But when are we going to say, well, there has to be something there? What is going on? Why are we having more people die from drug overdoses? And interestingly, in the state of Colorado, last year I thought there was a little dip in our overdose data, but this year we broke another record. And interestingly, there's been a slow creep of marijuana in our drug overdoses over time. And I'm trying to work with the coroners and medical examiners saying, look, you have to differentiate between, is this like the synthetic THC or is it the plant THC that's, people aren't overdosing, but people can have heart attacks. They can run into other medical issues. But why is marijuana starting to pop up on our drug tests, our overdose data? And not a lot of states are following this. And that's why I think it's important that other states look at this. Because to me, it's much more apparent to the outside person. They're like, what are you talking about? You're just talking and not really giving me anything to stand on. But I think over time, the data is much more clear.
What are you hoping to achieve with this?
I mean, the genie's out of the bottle.
Yeah, and also just to give context, because yesterday you were on a Sirius XM show talking about this stuff. You do webinars and you're invited on different shows and platforms to always talk about these things. So you're doing a lot of work when it comes to this. Where do you see this going? What would you want to achieve from all this work that you're putting into it?
What I want to achieve out of this is a good community understanding of what is happening with expansion and commercialization of marijuana. It's following the same path as big tobacco and alcohol and any other addiction for profit industry. And now the psychedelics are following right behind it. But what I want to achieve is just community education, knowledge, and understanding of the risks that what they're using might cause a problem. I want the perception of harm to rise, so maybe use will go down, just like we did with alcohol and opioids and tobacco. People still drink, they still smoke, they still take opioids, but I think the knowledge base is there, and they know the risks, they understand the risks. Right now, people don't understand what's going on, what the road they're going down. They may say, well, man, I'll smoke some weed, and next thing you know, they have a heart attack or a stroke. Because there's the heart in the cardiovascular system is the second target organ after the brain. Or you may have a psychotic break. I mean, Bren Spetcher, we talked about that the other day, who was a young woman from California.
A horrible story.
Yeah, she became acutely psychotic and stabbed her friend 108 times with 2 knives and tried to stab the dog and stab herself. And it took several people to tase her, and they broke her wrist so she can let go of the knife. She was actually on Dr. Phil talking about it, and she didn't get any jail time, interestingly. And I can tell you so many episodes of like Levi Tamba.
Yeah,
who jumped out a window.
Yeah, but these are. It's important to say that these are not like picked anecdotal stories. It's multiplied and multiplied and multiplied in all these different states where marijuana is legal.
Right, and you talk about mass shootings and acts of violence. We have a mental health crisis right now. We've got a drug overdose crisis, and the one common denominator I see is marijuana. It seems to be the girl at the dance that no one's asking to dance. But she's just there, right? She's very benign. She's very, she's there. And is she the reason for all this stuff? No, but maybe, who knows? But that's what I'm trying to accomplish is, like, for example, I have toxicology reports of mass shooters, and there's only one thing in their system. I have, and like you said, we're just in the infancy of this whole, I don't call it a social experiment, because when you run an experiment, you should care about the outcome, right? I don't know what to call it. But we're really experimenting on the consumers with the product integrity issues. Yeah. We're running into problems with homicide, violence, mass shootings, driving fatalities, and there always seems to be this common denominator of cannabis somewhere in the mix. Like, for example, in Texas, which represents about 10% of the U.S. population, and they're one of the only states, I think Texas, Florida, and Arizona are the only states I'm aware of that are looking at child neglect and abuse fatality. And in Texas, for example, if you look at a dead kid in the state of Texas and the substance by the perpetrator, either active use or past use, marijuana is number 1. Guess what number 2 is?
Alcohol.
Nothing. And then way down at the bottom are the usual suspects: the alcohol, the opioids, the cocaine, and the meth. And at one point, not last year, but I think the year before, the number of dead kids in the state of Texas where the perpetrator either had a current or past use history of marijuana was more than all other substances combined.
The product integrity is, again, a real scary one, which I thought to myself the issue was solved when once, I could go into a dispensary in Colorado or California. So you're saying that even those places, there isn't really any product integrity. So it just makes me even more scared for all the people that are stopping in gas stations to buy a
Delta
CBD.
8.
And that's a whole another one, right? Because,
right.
So that was, I live in Florida. For as far as I knew and know, recreationally, cannabis is illegal in Florida. But you see dispensaries, full-on dispensaries, with flowers and joints and everything that are selling Delta 8 THC and Hemp THC, which is very confusing. And I, one time I even walked into a store. I won't mention which one, so not to throw him under the bus.
Right.
But he told me that he probably just wanted to sell me something, but he told me that they have to put on the label that it's Delta 8 THC, but it's not. It's Delta 9 is Delta 9 the original?
Delta 9 is the traditional
one. So he told me what's inside the product is Delta 9, but to be able to sell it legally, they have to put a sticker of Delta 8.
I'm not surprised.
I was also not surprised, if we choose to believe him. I was also not surprised. But then, so the product integrity in those places must be, I'm assuming, like way scarier, way, less supervision than big fancy dispensaries in states like Colorado, California.
I think people are trying to follow the rules. But everybody I talked to on the industry side said, we're doing it right, our products are fine, we test them, blah, blah, blah. Mm-hmm. Look at the state of Oregon that's, just as far along as, California, Washington, Oregon, Colorado. We kind of went down this road first. The state of Oregon audited... Trailblazers, or blazers, or whatever you want to call them. So the state of Oregon audited their marijuana program in 2019, and they were only able to inspect 3% of stores for compliance. 3% were inspected, not 97%, 3%. And they only inspected 1/3 of growers for compliance. And the state of Oregon in 2018 concluded, we can't guarantee that the test results are reliable or the products were safe for human consumption. How come nobody talks about that? That was a huge publication. Mainstream media didn't pick it up. The public didn't pick it up. But it's there in black and white, and it's a long, lengthy report. The lab director in California was caught faking the test results for products. He was the director of the cannabis testing lab. So with any when there's money involved, corruption follows. And Colorado inflating THC content, we've seen that. Lab directors faking the results because they just want more money. The bud tenders I know in Massachusetts said that they worked behind the counter and they brought up concerns about moldy weed, and they were told by their supervisor, sell it. Don't tell anybody that it's moldy.
Are people angry at you for surfacing like some of these problems?
Probably. I don't care. I'm from New York.
Do you feel it?
I got thick skin,
Do you feel it? Do you feel that people, other...
I think I'm okay to have a discussion, and I can agree to disagree with anybody. But I think when you get to the, like in my camp, for example, I know people that are they aren't nihilistic. They are prohibitionistic. I'm not that way. I really approach this from a public health and safety perspective. Yeah. And if I do my job and I educate the consumer, I don't care what you do, but you know what the risks are.
Yeah. So if we go back a second to those Delta 8, THC and hemp, what is that? Like, what is that? And are people more at risk by consuming those products versus the traditional Delta 9 THC?
Well, this is where the whole Farm Bill comes into play. And the industry knew exactly what was happening when they passed the Farm Bill, because from the Farm Bill, or hemp, federally legal hemp has less than 0.3% THC by dry weight. And what they make from hemp is massive amounts of CBD. And CBD has a molecular formula, right? There's carbon, oxygen, hydrogen, and there's a formula for what CBD is that comes from hemp. And what people knew and what they did is they can manipulate that molecule and create what's called an isomer. So the molecule is a little bit different, but has the same exact molecular formula. And so they can convert CBD to Delta 8 THC. So even though they call it a hemp product, it does have tetrahydrocannabinol in it.
Yeah. From
hemp to CBD to Delta 8. And they can make Delta 10, the THCP, the HHC, the tetrahydrocannabinol, all these other isomers and analogs and products. I mean, and from Delta 8, people can make something called THCO, or the O-acetate, which is actually not a naturally occurring molecule, but actually was weaponized by the U.S. military in the 1940s as a chemical warfare agent. Why do people not connect these dots? And so I think the Farm Bill was just a backdoor to legalizing THC because the Fed said it was okay.
Yeah.
And so now a lot of places are trying to pull it back because they realized finally, I've known this for years, but now the state leaders are finally knowing this. And so that's why I think they just recently started repealing some of the things. And I think 17 states ban the Delta 8s and the isomers. Colorado's one of them. We don't have them here. Mm-hmm. But Florida, Texas, New Jersey, you can go to a gas station, convenience store, buy a Delta 8 THC. People say, well, it's coming from hemp, so it should be fine. Yeah. I think that's the message that is being sent.
Which is kind of believable in a world where we just don't know about, the science behind these things.
Right.
It sounds good.
Right, and from what I know from the on the industry side, it's like weed light. It's not like the Delta 8 is not as strong. The experience is not as robust when you are consuming Delta 8. But if you consume enough of it, you're certainly going to have the same risk because it's the same molecule. It's the same. It's THC, but just where the double bond is in the molecule makes it and call it something different. That's the difference. But you can still run into the same problems if you consume enough of it.
I see. And what is synthetic?
That's like K2 spice, that sort of stuff. That's like the synthetic cannabinoids. Those are really deadly. But they're not the same molecule from the plant. They're synthetic THC.
I see. Yeah, it's because it's scary because you.
I don't want to scare you,
Yeah.
but I was talking to the legislators in South Dakota, and one of the legislators said, "Thanks for the front row to the horror show." And I said, "I don't want to sound alarmist."
Yeah.
And then that's the thing. People that don't know what I know, and I tell them what I know, they think, well, you got to just be a prohibitionist because you're saying all these bad things about marijuana.
Yeah.
And that's not my point.
Yeah.
My point is if a state goes down this road, they need to know what to expect because in Colorado, California, Washington, Oregon, we had what we called unintended consequences. We didn't know that the industry was going to blossom and create all these 90% products. We knew, kids were going to get their marijuana card at 18 without parental consent and then do looping where they can go to store after store after store and then become the school drug dealer. We didn't realize the driving fatalities were going to go up related to marijuana. So we had these unintended consequences. Now I tell state leaders, you can't claim ignorance. And if you go down this road and you have significant public health implications, that's your legacy. So do what you want, but I'm just telling you what's happened.
What's the response, generally speaking, from state leaders?
Thanks for the horror show. Yeah. And actually, I think
but maybe the horror show, when I said it is alarming to me. We've been speaking about these things for about a year now. Mm-hmm. And at first, when you started saying these things to me, I was like, "Oh my god, geez! Like this guy, is probably
crazy.
Probably had some bad experience with marijuana back in the day or something." But looking into the stuff that you sent me, and you've emailed me a lot of different.
I've got a lot more too.
Yeah, I'm sure, and I've watched a bunch of your talks, and now we spent time together. But the alarming piece of it is maybe important because it's what got me into this vision that you have of a community of at least understanding or questioning or just being aware to the potentialities of this this girl at the school dance.
Right. And she just seems to be there.
She's there.
But nobody talks about her.
Yeah.
She's somewhat ignored. And again, not everybody that uses marijuana is going to have a problem.
Yeah.
I mean, the vast majority of people that use are fine.
Yeah.
Just like the vast majority of people that use other things responsibly are fine. I know people that use them are fine.
Yeah.
So that's not the point. It's not like stop using or you're going to burn in hell or whatever like that. It's just really public health and safety. Just like any other substance that is creating public health problems and healthcare utilization. I mean, I'm a physician, and when we see the negative effects from a healthcare perspective, we have to say something. Because one of my friends here in Colorado, he's a business leader, and I pinned him down in 2009, 2010. I said, "What's your perspective?" And he nailed it. I use it a lot in my talks. He said, "What made the most noise is when the doctors said nothing." I mean, the AMA said nothing. I mean, actually, they're a little bit more liberal on it, but the doctors aren't saying anything. But if you go to a lot of the national medical organization websites, like the American Psychiatric Association, they have a position against using it because it hasn't been proven to be effective to treat any mental health condition. But mainstream media doesn't want to talk about that.
Yeah.
They want to talk about, it helps anxiety and PTSD. Yeah. But I'm always quick to remind people that Chris Kyle, who was the American sniper, the American hero, was shot and killed by Eddie Ray Routh, who had cannabis psychosis. Yeah. And he was probably self-treating his PTSD with cannabis. Yeah. And that's what people don't hear. And that's why they're not connecting the dots, because they don't want to hear it. I mean, so all these medical organizations like American Psychiatric Association, the American Academy of Neurology, multiple societies have a position statement against it because they support doing the research and proof, just like they're saying the same thing I am, but they're not vocal about it.
No.
They just say, okay, we'll put it in black and white, put it on our website, we're done, we're going to move on. No one's going to look for it unless you look for it. It's there.
Yeah. So, in the last couple decades, physicians are allowed to not prescribe, but
Recommend.
approve medical cannabis use, like give you the card, right? So they have that ability to approve you.
Well, the card comes from the state.
Okay, but
So the patient fills something, the doctor fills something, and then the state looks at it and they
I see.
Send it to the
But at
patient.
the end of the day, it's the doctor who recommends or approves the state to give you the card.
And I've never heard of one doctor saying, no, I'm not going to recommend marijuana for you, ever.
Yeah. So there's that, which the doctors do. They approve the card or recommend the approval of the
I'm
card.
going to interject there for 1 second.
Yeah.
There are over 7,400 doctors in the state of Colorado. Less than 3% of them have made a marijuana recommendation. So it's not a common practice in the state. And there was one doctor in 2022 that made between 7,000 and 8,000 recommendations in 1 year. Yeah. And there was 3 doctors that wrote for more than 50% of the state of Colorado's medical marijuana.
So people know where to go.
3 doctors. This is very reminiscent of the pill mills.
Okay,
Back then.
so that's really interesting. That's really interesting. That's really interesting, actually. So only 3% of doctors are recommending.
3 doctors recommended more than 50% of all of the state's recommendations. Thousands and thousands of them, tens of thousands.
So that's a
frightening data point.
Yeah, that's an interesting one, and we know who those doctors are.
No, because the state won't release their names. The patients might know who they are.
And the state knows who they are.
The state knows who they are, but they protect the doctors.
Yeah.
Like, for example, I have a very good friend whose son, Johnny, committed suicide related to cannabis psychosis. And the parents obviously were very upset about their son who got a medical marijuana card. They cannot sue that doctor because the state protects the identity of that doctor. So they're hosed.
So education for doctors, because again, even if it's 3% of them who are recommending the use of, it's still a lot of doctors who are doing it. Numbers wise, a few hundred docters.
Oh no.
How many? So how many?
Well, what's 3% of 7,400?
Oh, but that's only in Colorado.
In Colorado.
Yes, but in wherever it's medically legal in the United States, which is most states now.
38 states, I believe, last I checked.
So it's a lot of doctors, though, that are recommending this. And are the doctors, do they have any education?
No.
So which is another huge void in this whole system,
That's
right?
why I do what I do.
So do you find, like, doctors who are maybe neutral when it comes to,
Yes.
this, who are questioning and are coming to you to learn more and signing up for these things to find out, if they should be recommending, if they shouldn't be recommending? Because I'm assuming it's something that you don't learn in medical school.
No, there's no treatment. I'm trying to work with medical schools to develop a curriculum.
So even today, like physicians who are graduating from medical school, they're not taught anything about cannabis.
And interestingly, the recent data shows, I think, 8 to 10% of physicians that are graduating from medical school are chronic users of marijuana.
That's alarming as well.
To me, it is. So, for example, if you were going to have knee surgery, would you be okay?
No, I wouldn't.
If you knew your surgeon or your anesthesiologist just took a hit off a dab rig, last night, because we know the impairments, cognitive, can be long lasting, even though it might be out of your system.
Yeah.
And that's what makes marijuana so covert and insidious. It's like Johnny, for example, when he was diagnosed with cannabis psychosis, but when he died, he was negative for THC. But we knew that his psychosis was precipitated by cannabis. And, with my friends in the emergency department, they are seeing people coming in with cannabis psychosis to the emergency department. And, we're in the middle of mental health crisis, which alone is complex. It's multifactorial. But these cannabis psychosis patients are ending up in the emergency department. And after they're there for weeks in the ED because there's no placement, because there's no good mental health treatment anywhere in the country. And so they're sitting there in the hallway, psychotic for weeks on end. That's called persistent psychosis. Even though it may be a little bit left in their urine, it's out of your blood in 6 hours. So by the end of the day, it's gone in your blood. But it's what we call lipophilic. It likes fatty tissues like the brain and adipose tissue or fatty tissue in the body. And so that's where it hides. And that's why it can be positive for weeks, because it's kind of leached out into the bloodstream, the metabolites. Yep. That's why it ends up in the urine. But even though their blood is negative, they're still psychotic. They still don't know where they are. They're seeing things that aren't there. They're hearing things that aren't there. And again, not everybody that uses. That's why I want to get that point across. Not everybody's going to run into this problem.
Yeah.
But even if the percentages remain the same, with expansion and commercialization, more people are using, and the percentage is the same, that number is still going to rise. So that's another one of my concerns is the number of people using is going up because it's more acceptable, it's more available, accessible. And so even if you're not going to run into that problem, if it's 1%, 1% of 100 is 1. Yeah. 1% of 1,000,000 is a lot more than 1. Right? Yeah. That's what we're running into.
What do the medical schools say about this? If you when you approach them to try and build some, educational program, curriculum,
we'll get back to you.
So you haven't seen success yet with one that's
No,
that's on board
I have a whole curriculum ready to roll.
But it's crazy to me that again, the doctors, even if it's 3% or whatever the number is, that are allowed to recommend something that we generally as a society don't really know much about.
No, the 7,400 doctors in the state of Colorado are allowed to recommend.
Yeah, they are allowed.
They are allowed.
Yes.
But only 3% are.
Yes, but just,
right.
But all of them are allowed and have the ability to. But it's not something they learned about, and it's not something they're required to learn now. How can that be?
Well, you bring up an interesting point. For example, my patient...
That's alarming to me. Yeah.
I just had a patient the other day, yesterday, who is on chronic opioid and is using marijuana for their pain. And their pain's like 8 out of 10. And we've had this discussion before. I said, look, if you want to use your marijuana, I don't have a problem with it, but we have to taper your opioids. Because I don't believe in co-use of multiple centrally acting substances. We already have a black box warning with benzodiazepines and opioids for risk of overdose. I don't like people using opioids and cannabinoids because they're both centrally acting as well. And so I had this discussion with them. And in the state of Colorado, if you want to be a recommending physician, you have to have a valid unrestricted license. You have an active unrestricted DEA. And so you can practice medicine in the state, right? So my conversation very frequently said, well, if you want to use both, I'm okay with that. But I'm not going to prescribe you opioids. Go back to your recommending doctor who gave you your marijuana card, and they're allowed to practice medicine. They don't see these patients. They don't treat these patients. Because all the patients that I bring that up, they said, my doctor won't do that. They just give me my card and that's it. It's bogus.
Yeah. Yeah, it's scary. It really is scary.
And I don't want it to be scary. I just want it. This is boots on the ground perspective. This is what's happening, and that's what people don't see or hear about. So that's what I'm trying to accomplish here, is just really piercing the veil of this industry, because it's all about money. It's all addiction for profit. And again, not everybody's going to get addicted, but it's money. Why would Big Tobacco invest heavily in marijuana? Well, they're losing market share, right? Why are the lab directors being corrupt? Because they just want to make the money. Why are the THC on the label higher than what's actually on the product? They're going to make more money. So where money comes, corruption follows, and that's what's happening. And the state leaders, I don't think, can spell P&L, profit and loss, because all they talk about is the profit. They never talk about the losses associated with these industries. I mean, like I mentioned earlier, alcohol, tobacco, opioids, they make a lot of money. But we know there's a cost to that. They never talk about the societal costs to marijuana, even though we know they're there. I mean, I published a paper that one hospital here lost $20 million in 6 years just from marijuana-related ER visits. That's one ER out of 25. Yep. You take that number hypothetically, that's a $500 million price tag just from ER, not from driving fatalities, not from addiction treatment or mental health care. None of that is factored in. One paper showed that for every dollar generated in Colorado, it costs $4.50 to regulate. I don't believe in the $4.50. I think that's a little inflated. Yeah. Certainly not a moneymaker. It's probably a net negative.
And you also mentioned that the black market has only been on the rise since
alive and well.
Since 2009.
Alive and well in every state.
Yeah, which is also was I guess sold to the country, right? That one of the ways to tackle the black market is legalizing.
That's what they say. And actually, I think every single state has Chinese cartel, from Maine to California.
Is that allegedly or?
No, that's well documented. Well documented. I can send you all that information if you want.
Please.
Yes, of course.
Yeah, that's crazy.
But it's not just a Chinese cartel.
Yeah.
I mean, the folks I know, I do a lot of work with law enforcement around the country, and the folks I know in Northern California, I'm going to send you some emails. This can be edited out, I'm sure. Yeah. But I'll send you some emails of what is happening that will scare the crap out of you.
Good.
In Northern California, what's happening from the law enforcement perspective, they're getting killed. Just trying to battle the black market.
Yeah, I saw an interview once with the game. Was it a game warden? They're called the people that.
I think he may have been the deputy sheriff. You may have seen.
Maybe that again, just like just by regular patrols of forests and things, they're discovering like huge.
Have you seen Murder Mountain?
No.
Watch Murder Mountain on Netflix. It's actually it's a documentary.
Murder Mountain.
Mm-hmm. All right. Documentary on a young man who moved to Northern California to make money.
Yeah.
In the industry, because it's like, we're going to make money.
Yeah.
And he ended up getting killed. And his father, it was a story about the father that went to Northern California to find. I'm not going to spoil it for you, but Murder Mountain is very interesting. And I know a couple people that were in there. I didn't know I knew them until I saw it. And I'm like, I know that person. I've talked to that person. I emailed that person. But what's happening on the black market side is truly frightening. We have human trafficking issues. We have water and soil poisonings. We have death of endangered species. I mean, for an industry that prides itself on herbal and green and natural and medicinal, they've got a huge carbon footprint. Yeah. They are a energy hog. Yeah. For example, I think I told you that the Colorado's marijuana industry creates more carbon emissions than its coal industry. We know coal is bad for the environment, but now marijuana is bigger in Colorado in terms of what it's doing, especially in this day and age of global warming and climate change.
Yeah, people wouldn't even believe it. Like those things, people would dismiss them immediately, those arguments.
I've got the argument. And that's what I tell people. Don't believe me. Yeah. I don't care if you believe me or not. If you don't believe me, look it up. Yeah. Do your own research. Come to your own conclusions, right?
So we're going to wrap this up because we're going somewhere after this to consume a couple beers, alcohol. So not the girl that's in the dance,
not the girl that's at the dance,
but we'll drink a couple beers. So just to wrap up, what would be then your message to physicians, like yourself, who, whether or not they are recommending or signing off on cards, but what would be your message to them when it comes to this, usage of medical
just physicians
cannabis?
Or in general?
I would say first a message to physicians, and
do your research, learn, educate yourself. Don't believe me,
and they'll find it. Like they'll find this stuff that you're talking about.
Absolutely.
And what's the name of your organization that
our nonprofit?
Yeah,
it's the International Academy on the Science and Impacts of Cannabis. I also edited a medical textbook called Cannabis in Medicine: An Evidence-Based Approach with 70 authors from 4 countries in a year and a half of my life I'll never get back. And I have a lot of respect for people that edit text, because I didn't realize how crappy doctors write. I mean, I was raised in very grammar, punctuation, and a lot of people don't know how to write. So I had to do a lot of editing. And today, I mean, the data in my book is dated but not dated.
When did your book come out?
2020. Interestingly, I don't know if I had that conversation with you about Peggy Mann. Did I ever tell you about her? Peggy Mann was a journalist in the late 70s, early 80s. And she went to the marijuana researchers around the country at the time in Mississippi and California. And she published a book called Pot Safari. And Peggy actually got the Congressional Medal of Honor for drug education. And she was awarded a medal by President Reagan. And so I read Peggy's book. After I published my book, I read Peggy's book. And I'm like, I thought I was really smart. Everything in Peggy's book was in my book. In utero exposure problems, the effects on the lung, the effects on the brain, the effects on cognitive ability, psychosis was in there. And I read a paper from the 1800s on psychosis in India hemp. So it's been around for a long, long time. But again, just like tobacco, we're only seeing the very beginning of the problem because we're mass commercializing and expanding these programs. And the perception of harm is at an all-time low, so use is at an all-time high. But I think the message to physicians is educate yourself, learn, have discussions with your patients, and tell them buyer beware. I mean, that's one message I have is buyer beware. I think people are trying to do the right thing and make sure their products are not contaminated. But we have recalls here in Colorado. Return your product, what's it, June now? Return your product from April or from February. Those products are gone, and the damage is already done. And I think I mentioned to you in the Middle East, they use cannabis as a soil remediator. So they plant cannabis to get all the stuff out of the soil. Well, where does it end up? It ends up in the plant. And then people are consuming the plant or smoking the plant, and all those poisons are there.
What would your message be to, occasional pot smokers or chronic pot smokers who don't think it's a big deal because they've never seen anything bad themselves happen to one of their friends or to themselves? They've only had positive experiences, a good time, help with anxiety, help with sleeping, these things that, because one might live their entire life being a chronic user without having knowingly any adverse effects, not being exposed to conversations like this,
right?
And only experience positive things from the plant. But those individuals never know that tomorrow they could be the victim of psychosis, schizophrenia.
There's no good predictor, and just like anything else, not everybody that's using is going to have a problem.
Yeah.
The vast majority of people that use are not going to have a problem. My message to them is just be careful. You don't know what you're going to get tomorrow, right? And if you're using with no problem, I'm okay with that. I really don't care if you're using safely and responsibly and you're not getting behind the wheel and running people over or running children over or bicyclists or something like that. Because we're seeing a lot of that. The alcohol people tend to just get in car crashes. But the marijuana users, Colorado State data shows there's more people injured by marijuana users that are cyclists or pedestrians or strollers. They're running over random people, not just around a telephone pole or into another car. That's a very interesting difference. But I tell the people that they're using responsibly and having good experience, I don't care. That's fine. Just be careful. Just like the people, my patients that are smoking a pack of cigarettes a day, I'm like, I wouldn't recommend you do that. You're going to continue to do it because it's addictive. The question of the chronic user is, could you stop? Try stopping for a while. I can probably guarantee you that the vast majority of them are addicted, and a vast majority probably can't stop.
So, so one more thing to throw in there, because you mentioned the word addiction as well. Is cannabis addictive?
Yes. The data from the 1990s, and the potencies were lower at the time. Remember that.
Yeah.
The data was for the adult was about 9%, and the adolescent was 18%, and that's probably because their brains are developing. That was 1990s weed. The data that came out of National Institute of Drug Abuse and NIH shows the addiction rate now is 30%. 1 in 3 people are going to become addicted to marijuana. And so it is addictive, just like any other substance. That the way, the dopamine receptors, the drug reward pathways are all influenced by the endocannabinoid system. So yeah, there is an addictive potential. Yeah. And I asked the chronic user, the question I would ask is, why are you using every day or near daily? Can you stop? And I would suspect that a lot of them can't because they do have addiction. And there's a withdrawal, syndrome related to cessation of use. Yeah. Similar to opioids, similar to alcohol, similar to nicotine. It's drug craving, they're anxious, they're jumpy, heart rate goes up, they can't sleep. Yeah. So it does have a withdrawal syndrome. Well documented. There's actually a code for cannabis withdrawal syndrome, and a code now in the world of medicine for cannabis psychosis or other untoward cannabis-related medical disorders. Yeah. So that's the message I would give to that chronic user. If you're using, fine, or even the occasional user. I don't care if you're using occasionally. Just don't get behind the wheel and kill somebody, or monitor yourself. I mean, I have had patients that have used occasionally. I had one gentleman interview me from California. He's like, yeah, I use every now and then, But I had an episode. I had a mild psychotic event. And he goes, it was just probably bad weed, whatever. And then he went like a month or two without using and used again. And he had another psychotic event that was worse. And it really scared him. And he's like, I'm just not going to use because I see this path I'm going down. But he was at least insightful to see that. So people can have palpitations. They can have a little chest pain. They, feel, the tachycardia, the elevated heart rate, the blood pressure can trigger other negative events like a stroke or heart attack. And, marijuana users, chronic marijuana users have an earlier onset of coronary vascular disease. So there's so many, that's what makes it fascinating to me because it's so broad and deep. Compared to alcohol, tobacco, and opioids, which are very simple. I mentioned that earlier. They're very simple. These are the simple problems you're going to have with these three substances. Marijuana, to me, just touches almost every... I mean, the endocannabinoid system is everywhere in the body. And so that's why I think it has so many different effects. And so that's why I want to make sure that people, if they are using, I don't care if you're using, just be careful and buyer beware. Make sure what you're getting and what you're using product is consistent with the labeling, but we know the labeling is very often incorrect.
So have a good time, everyone, and be careful. Watch out and open your eyes. Listen to yourself as well. Listen to what seems sometimes logical, because I guess a lot of the time we choose to omit information that
doesn't go against your
doesn't
brain.
Go with what you like doing, because so.
And I want to make sure that if people enjoy using cannabis, I'm not saying you're a bad person. I don't judge people by whatever they're doing. I know people that drink too much or smoke cigarettes too much or all this other business. But if you're enjoying it, I'm not going to judge you by your behavior. Again, my job is strictly and primarily from a scientific and public health and safety perspective and angle. I just want to educate you on the things that can go wrong, because that's my job. We counsel our patients and our friends and our family.
And I appreciate that very much. So thank you. And thank you for doing this and being here with me. It's a pleasure spending time with you in Colorado Springs.
Of course, thank you. I'm back.
And until the next time, we'll do the Manitou Springs incline.
Yes.
Again.
And you'll probably beat me this time.
I hope so. I love, and we'll end on this, but I love experiences like we had this morning that are like a slap in the face, just to show you, just a reminder to work a bit harder and get fitter, and be, more adaptable and flexible to different types of fitness. So it was good. And what is it? 2,700 and...
over 2,700 steps.
Over 2,700 steps.
And almost a mile in length. And I think 1,800 feet of elevation gain.
Yeah, jello legs.
Yeah.
So it was very fun. So Dr. Ken Finn, thank you very much.
Of course. That was fun.